They're too small to see with the naked eye, but they pose health risks that are too big to ignore. Bloodborne pathogens. They are the disease-causing microorganisms found in human blood, as well as human blood components and products. Exposure to bloodborne diseases is a serious concern, and as a result, the Occupational Safety and Health Administration, OSHA, has developed regulations for dealing with bloodborne pathogens in the workplace. While there are a number of bloodborne pathogens, hepatitis B, hepatitis C, and the human immunodeficiency virus, or HIV, currently pose the greatest threats. This program will show how exposure to bloodborne pathogens can occur in first response environments, how regulations and required procedures help to prevent such exposure, and what to do if exposure occurs. The dangers associated with the HIV pathogen have received a great deal of public attention. It is reported to have infected over 1 million people in the U.S. alone, and it continues to spread. Symptoms experienced at the onset of HIV infection can vary. They include weakness, fever, sore throat, nausea, headaches, diarrhea, and other flu-like symptoms. But many people with the HIV virus show no apparent symptoms for years after their initial infection. There is still no proven vaccine that can prevent HIV and no known cure. However, great strides have been made in treating HIV, and there are several drugs and drug combinations that appear to be effective in controlling the disease and relieving its symptoms in many people. People who contract HIV risk developing acquired immunodeficiency syndrome, AIDS, which attacks the immune system. This reduces the body's ability to fight off other diseases and, as a result, can ultimately be fatal. So controlling the HIV pathogen is very important. Hepatitis is a liver disease. It usually results in an inflammation of the liver and frequently progresses to more serious conditions, including cirrhosis and cancer. Each year in the U.S., there are over 40,000 new cases of hepatitis B, the most common type of viral hepatitis. And it is estimated that more than 3 million people in the U.S. are carrying the hepatitis C virus. In fact, the prevalence of hepatitis is so widespread that many experts consider it to be a greater transmission hazard than HIV. While there is no known cure for hepatitis B, a vaccine is available that can prevent infection. In some cases, the same vaccine can be effective in preventing infection after exposure as well. Currently, there are also treatments that can help to control hepatitis B and relieve its symptoms. In recent years, there has been even more progress made in the treatment of hepatitis C. Today, there are drugs that can actually cure hepatitis C in many people. Hepatitis B symptoms can take 6 weeks to 6 months to develop. Symptoms of hepatitis C from 4 weeks to 3 months. The initial indications resemble those of a mild flu. There is a sense of fatigue, nausea, loss of appetite, and possible stomach pain. Often, jaundice, a distinct yellowing of the skin, will eventually develop, as well as a darkening of the urine. In first responder environments, bloodborne pathogens are most often transmitted parenterally. This is when microorganisms that are present in a substance are accidentally injected into a worker by a contaminated sharp object. These exposures most often occur through punctures from infected needles or human bites, and are so common that preventing parenteral exposures is one of the major focuses of the OSHA bloodborne pathogens regulation. Other ways of transmitting bloodborne pathogens include skin abrasions or cuts that come into contact with potentially infectious materials, such as blood, human tissue, vaginal secretions from discarded hygiene products, and other body substances with blood in them. Now let's take a look at what OSHA's bloodborne pathogen regulation requires of your group. The first step involves the creation of an exposure control plan. This plan spells out how your facility will address the requirements of the regulation itself and includes a determination of each employee's potential for exposure to bloodborne pathogens and an examination of ways to limit or eliminate these exposures. The Exposure Control Plan also deals with setting up a hepatitis B vaccination program, as well as procedures to be followed whenever an accidental exposure occurs. Other parts of the plan address warning signs and labels, employee training, and keeping records regarding exposure, vaccination, and training. The plan must also incorporate the use of standard precautions, which require that all human blood and other body substances be treated as if they are known to be infectious. For people who work as first responders, one of the most critical issues the Exposure Control Plan addresses is how to reduce the risk of needle sticks and other sharps injuries. The Centers for Disease Control estimates that contaminated sharps cause nearly 400,000 injuries each year. When these injuries involve infectious agents such as hepatitis or HIV, the affected workers are almost always at risk of contracting some bloodborne disease. One of the things OSHA has done to help combat the danger of needle sticks is to mandate that exposure control plans be reevaluated at least once a year. A major focus of these reviews is to make sure that your facility is using every means available to keep you safe. As a rule, the review must confirm that the exposure control plan reflects changes in technology that can eliminate or reduce exposure to bloodborne pathogens, documents the investigation and implementation of new medical devices that are designed to reduce or eliminate occupational exposure to bloodborne pathogens, and incorporates the opinions of frontline employees whose interactions with patients expose them to potentially contaminated sharps. If you would like to look at your facility's exposure control plan, see your supervisor. Now let's take a closer look at the most important parts of an exposure control plan. Labeling is the most visible requirement in the regulation. Containers carrying any potentially infectious materials, such as blood or tissue, must be marked with a biohazard label. Biohazard labels must also appear on any equipment and materials that are suspected of being contaminated, such as stretchers and air packs, or police evidence, such as weapons and clothing. The word contaminated indicates the presence or anticipated presence of potentially infectious materials on an item or surface. Biohazard labels are fluorescent orange-red with the biohazard symbol in a contrasting color. The word biohazard is also marked on the lower portion of the label. Red bags or red containers can substitute for these labels. There are several exceptions to these labeling requirements. Individual containers of blood do not have to be labeled if they are placed inside another labeled container for transport or storage. Labeled blood products released for transfusion or other clinical use are also exempt, as long as these specimens remain in the facility. Common places that you will see biohazard labels include refrigerators and freezers containing blood or other potentially infectious materials, containers used to store, transport, or ship these materials, contaminated equipment awaiting cleaning, and containers of regulated waste. In this case, regulated waste refers to several things, including potentially infectious materials such as blood, items such as used bandages and dressings, contaminated bedding and towels. Contaminated sharps, including needles, scalpel blades, and broken glass, are also considered to be regulated waste. So are containers that may have had infectious material in them. In addition to encountering victims of accidents or violence, activities where you might reasonably expect to encounter bloodborne pathogens include handling blood products, emptying trash and performing other cleaning duties, changing linens on stretchers, beds, or examination tables, refilling first aid kits, working with soiled laundry, handling contaminated equipment, examining crime scenes, and preserving evidence. Your employer has compiled lists of job classifications and activities that may present a risk of exposure to bloodborne pathogens. These lists can be found in your group's exposure control plan. There are many ways that you and your employer can work to reduce your exposure to bloodborne pathogens. They include the use of standard precautions, remembering to treat all blood and body substances as if they are infectious. Engineering controls, following safe work practices, the use of personal protective equipment, and appropriate housekeeping practices. Engineering controls refer to equipment or machinery that can minimize exposure. Your facility uses many of these already, such as puncture-resistant sharps containers, tongs to pick up contaminated materials, and sharps with engineered injury protections such as self-sheathing needles. Safe work practices reduce the potential for exposure by focusing on the safest ways to perform tasks. Hand washing is one of the most important. If you have been involved in a situation where you may have been exposed to bloodborne pathogens, OSHA requires that you wash your hands immediately after removing any gloves and personal protective equipment that you are wearing. When you're finished, remember to use your towel to turn off the faucet. That way you won't recontaminate yourself on a surface you touched before you washed your hands. You must also rinse your eyes, nose, or other mucous membranes with generous amounts of water if they have been exposed. OSHA considers housekeeping practices to be very important to the control of exposure situations. Written cleaning schedules specifying the methods of decontamination that are being used must be maintained to assure that all areas are clean and sanitary. If they are obviously contaminated, work surfaces must be cleaned immediately with an appropriate disinfectant. Otherwise, this should be done at the end of each work shift. Broken glassware is not to be picked up by hand, but by using a brush and dustpan, tongs, or other tools. There are several safe work practices that must be followed regarding contaminated needles and sharps. They must not be bent. They cannot be recapped or removed unless there is no feasible alternative. If they have to be recapped or removed, you must use a one-handed technique or a mechanical device. Contaminated sharps must be discarded as soon as possible into appropriately labeled containers that are closable, puncture-resistant, and leak-proof. These containers must be easily accessible, left upright, replaced routinely, and never overfilled. They must be closed when handled and are subject to the same secondary container requirements as specimens. Rules also govern the handling of other regulated waste. This includes contaminated personal protective equipment, bandages, linens, and other potentially infectious materials that are being disposed of. These must all be placed in appropriately labeled, closable, and leak-proof containers. Containers must be closed and secured during handling. When the outside surface of the primary container is contaminated, an appropriately labeled secondary container must be used as well. If there is a danger that the items contained in the waste could puncture the primary container, the secondary container must be puncture-resistant as well as leak-proof. Another part of the bloodborne pathogens regulation concerns contaminated laundry. Laundry should be handled as little as possible and always bagged appropriately. It must never be sorted or rinsed at its originating location. Labeled or color-coded bags are required to transport laundry. Bags must be leak-proof if the laundry is wet and shows a potential for soak-through. Of course, all laundry must be handled with gloves and other appropriate protective equipment. OSHA also addresses personal workplace activities in the regulation. You should never eat, drink, or smoke in work areas where exposure to bloodborne pathogens could occur. Never apply cosmetics, lip balm, or contact lenses while you're in these areas either. And food or drink should never be stored where blood or other contaminated materials are kept. The last type of safe work practice the regulation addresses deals with equipment. If a piece of equipment is contaminated with blood or other body substances, a biohazard label must be affixed immediately. Once labeled, the equipment must be cleaned and decontaminated as soon as possible, using your facility's approved disinfectant such as diluted bleach. If it cannot be totally decontaminated, the equipment must remain labeled as a biohazard. Protective coverings on equipment must be replaced if contaminated. Before any piece of equipment is serviced or shipped, it must be inspected for contamination as well. All employees or service personnel who may come in contact with the equipment must be notified of the location and type of contamination that exists there. The use of personal protective equipment, PPE, is another part of the Bloodborne Pathogens regulation. PPE must be worn whenever there is a chance of exposure to blood or other potentially infectious material. Gloves are mandatory in these situations. Disposable gloves should be replaced as soon as possible after becoming contaminated. You should never attempt to decontaminate and reuse them. Disposables should also be replaced immediately when they are torn or otherwise damaged. Removing rings before putting on your gloves will help to keep them from tearing. Utility gloves, usually rubber or vinyl, are heavier and can be reused once they are decontaminated. However, they must be discarded if they are cracked, peeling, or otherwise damaged. Remember, you must change gloves and wash your hands after each exposure. If you are sensitive to latex, talk to your supervisor. Non-latex gloves will be made available to workers with documented latex allergies. Whenever there is a chance that fluids may splash or splatter, extra precautions need to be taken. At a minimum, masks and eye protection should be worn. There are a number of options to choose from. Standard safety glasses protect the eyes from direct exposure from the front. Side shields provide added coverage. Safety goggles fit snugly and provide complete protection of the eye region. Face shields protect not only the eyes, but the rest of your face as well. Pocket and other face masks are designed to protect the mouth and lip area. They should be worn whenever eye protection is used. Coats and other protective clothing can shield much of the body. They should be selected based on the degree and circumstances of your anticipated exposure and must effectively prevent the pass-through of fluids and other materials. Your group has personal protective equipment available for you in your work area. If you are unsure of the location of a particular item, ask your supervisor. You also need to be aware of your facility's procedures for handling personal protective equipment once it has been worn. Know the location of collection and disposal points and use them. Remember, you must take off your personal protective equipment before leaving your work area. Following safe work practices and using personal protective equipment can substantially reduce the risk of exposure. But your first line of defense against infection is vaccination. As we've discussed, although there are currently no vaccines that can prevent HIV or hepatitis C, There is a vaccine for hepatitis B, and it's been available for some time. The vaccine is administered in 3 injections given several months apart. Hepatitis B vaccines are safe. There is no possibility of infection through the vaccine itself. Your employer has set up a free hepatitis B vaccination program for all employees who are at risk of exposure. Your supervisor can give you more information about the program. If you are at any risk, it's important that you be vaccinated. It is so important that OSHA requires you to sign a form if you decline the vaccination. If you are accidentally exposed to hepatitis B infected blood and have not been vaccinated, your employer will offer you an accelerated vaccination series, also at no cost. Early detection is extremely important because many forms of hepatitis B are slow to develop. Vaccination may prevent infection if given in time. But after-the-fact vaccination does not always prevent the disease from developing. As careful as we may be, needle sticks, blood leakage, and spills can occur, so you need to know what to do in case of such an emergency. First, if you have come into contact with any potentially contaminated material, you should wash the affected area with soap and water as soon as possible. If the incident involves a spill or leak, you should soak up the material or contain it using absorbent barriers. Next, any surface that has been contaminated should be cleaned with your facility's approved disinfecting solution. Once the spill or leak has been dealt with, any contaminated materials should be disposed of in an approved waste disposal container. Any disposable personal protective equipment that has been contaminated should also be discarded. Reusable equipment should be recycled for decontamination. There are several important things that need to be done after an exposure to any bloodborne pathogen occurs. First, you will need to notify your supervisor and your organization's infection control group. You may also need to complete an incident report. If the exposure was caused by a contaminated sharp, your facility will record it in a special sharps injury log. This log is specifically set up to keep track of percutaneous injuries which penetrate the skin. Every entry into the log must include the following information: the type and brand of device that was involved in the incident, the department or work area where the accident took place, and an explanation of what happened. Immediately following the exposure, your employer will give you a written summary of the routes of exposure you experienced, the circumstances under which the exposure occurred, and, if possible, the identity of the individual from whom the potentially infectious material originated. Your employer will also try to determine if the sourced individual's blood is infected with hepatitis B, hepatitis C, or HIV. An appointment will then be arranged for you with a healthcare professional to review the medical implications of what took place. Your employer will provide the healthcare professional with information such as the type of work you were doing when the incident occurred, the result of the source individual's blood test, any of your medical records which are relevant to possible treatment. With your permission, your blood will also be tested to determine if an infection has occurred. Your situation will then be evaluated and discussed with you. If appropriate, medical treatment may be recommended. If hepatitis B vaccination is called for, it will be provided by your employer at no cost. The healthcare professional is also required to verify 4 things for your employer: that you have been informed of the results of their evaluation, that you discussed any medical condition resulting from the exposure which would require follow-up, whether you should receive hepatitis B vaccination, and whether you have received the first injection in the vaccination series. All other information that results from your medical evaluation will remain confidential. We've seen that bloodborne pathogens can pose real health risks for first responders, but there are practical ways to control these risks. The work you do saves lives. OSHA's Bloodborne Pathogens Standard creates a strong foundation for keeping you safe from infection while you're doing it. Now you have the knowledge and skills to do your job even more safely every day.